Thank you. Sort of like if they saw my name on it. Yeah, so that's what happened here. I was gonna say, so I went, I will get cunts, but I go, we don't get cunts. Although I may say.
Okay.
Everything here is on. Short dress.
I don't know if they're on 60, like, what we were doing, like, kind of. Oh, there's been so many of the boxes in
Into the microphone.
I that time.
We have an outside. How much 5 is it? Like 5 cents? Oh.
We have our.
Okay,
Thank you.
How quiet and then.
Oh, that's. Probably in your back.
I'm not. Yeah, I know we can find them.
Sometimes they can let them know.
Yeah.
I'm just being real kind of. this one.
Can't call out.
So we want to have it.
Not a problem.
You know,
Everybody, we're gonna get started now. We have it full, so everybody can be quiet.
so I don't really give it to her.
Starting over.
All right, I'm calling this meeting to order at 10:05. Would everybody please stand? Pledge. Katie, would you like to lead us?
Sure. Attention to the American flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This is odd having to hold up this microphone, so,
Well, you don't have to, if you want to sit down and just talk louder too.
okay. First, we're gonna do approval of minutes. Will County Public Health and Safety.
Sorry, you need to do it.
Oh, I'm sorry, I passed up roll call. Roll call, please.
Freeman,
She'll be here in a few minutes.
Berkowitz,
Here.
Costa,
Here.
D. Schlattman,
Here.
Hickey, here, Mitchell, Butler.
Here.
We have a forum.
Thank you. Okay, approval of minutes, Will County Public Health and Safety Committee, regular meeting, January 2nd, 2025. Can I get a motion?
Motion, Dean Schlattman.
Second.
Roll call.
Berkowitz,
Yes.
Costa,
Yes.
D. Schlattman,
Yes.
Hickey,
Yes.
Butler.
Yes.
Motion passes.
Okay, I don't believe we have any old business, no new business. We have some, but before I get started, I'd like to say, thank Elizabeth for putting this together. I guess this is not just something you do. I guess there's a lot of moving parts that have to be put together, so we appreciate it. Thank you very much. We have some informational reports, I believe, that are going to be happening, and then we're going to go into a tour. So, first we'll start with Elizabeth Plata.
Good morning, and thank you so much. I just really wanted to say thank you for coming to our campus. We are very excited to have you here at the Will County Health Department and the Community Health Center. In your informational report, you can see my report regarding our different divisions. However, last month I had spoken about our strategic plan. So I did provide you the timeline from our strategic plan, our mission, vision, and values, and then our strategic initiatives. And one of them is communication and engagement. And that is one that is actually why we're here today. Part of that is so that we can get to know you and you can get to know us. So thank you for letting us check one of the items off of our strategic plan as you're here today. So other than that, I just wanted to say, was there any other questions? If not, then I will move on and turn it over to someone else. And of course, we'll be at the next Public Health and Safety to elaborate on any types of reports that you would need. No, thank you so much for being here.
Okay, I see approval of Board of Health minutes next, so I believe that's our next item.
Yes. You need a motion?
Yep.
Motion, Dean Schlattman.
Second, Berkowitz. No, I'm sorry, you don't need to approve those for the health board.
Okay, so we're good.
Okay,
We'll be
Right,
right
thank you.
minutes.
all right, next we have from the Environmental Health Lab, Tricia. Hoots, I just want to say that I've met Tricia and she's very passionate about her job. I love it. It might be bacteria, but it's very important.
Hello, I'm Trisha Kaut. I work in the environmental health lab. I actually started as an intern in 1999. I'm dating myself. And then I moved into the analyst position in 2001. And in 2006, I became the manager of the laboratory. So we are a microbiology and a chemistry accredited laboratory, and we are a water analysis laboratory. So we do both we do both potable and non-potable well analysis. So for our microbiology analysis, on our wells, our potable drinking water, we do total coliform and E. coli testing. So homeowners can bring us in samples. When you sell a house in a well, you can bring us samples. We also test the Village of New Lenox water every month also, and some other organizations bring us water. So Courtney at the top is running our total coliform and E. coli testing. Once it has total coliform, you can kind of see in the bottles, it turns yellow and it will fluoresce if there's E. coli. And then we do a quantity tray, which gives us a numerical value. That's kind of what's in front of her. We also use the quantity tray testing to do beaches. We have about 11 beaches in Will County. We sample them during beach season every 2 weeks. And if they're bad, our intern keeps going out and bringing up samples every day until we get the bacteria level safe for swimming. So that is non-potable, but we also do it in our potable laboratory. So for our potable test or our non-potable testing, you can see Peter down here doing membrane filtration on our septics. We have, they're called individual mechanical systems in our county, about 3,239, I think, around there. IMS systems that actually, it's a little IMS system in somebody's backyard that discharges into the environment. So we have 2 samplers that go out and they test them. We try to test them twice a year at least. So for our microbiology, we're testing for fecal coliform bacteria. So that's what's on that plate. You read it under 10 to 15 magnification, and we're looking for those raised blue colonies after we incubate it. So that is somebody's actual like septic system water. So in our chemistry analysis, again, Courtney is over there running our nitrates on our wells. So we run nitrate, fluoride, and hardness sample on our wells. So we do nitrate and fluoride with an ion selective probe. So we have a meter, we set a calibration, we set what samples should read, and then we read samples and get results. And the hardness we're doing by titration. We're putting in chemicals, we see a color change, we take another chemical and we'll see the color go out. Then we do a calculation to get how much hardness if you're gauging a water softener. For non-potable or septic analysis, Courtney and Yesenia are doing our pH right there. So again, it's just with a probe. We do a biological oxygen demand that has an oxygen meter. It's a little more involved test. It's a 5-day test. And then we do residual chlorine by titration. It's kind of like the hardness samples. We put some chemicals in there. We change the color. It will change a blue. We titrate that color out and do a calculation to get how much chlorine's in there. And then we do a suspended solid, also using filtration. So we're seeing how much sediment is in those septic samples because most of them actually are pretty clear. Most of them have less than 100 for the results for the bacteria. Actually, probably about 95% come out good. So we, like I said, we're an accredited laboratory. So for microbiology, the Illinois Department of Public Health comes out to accredit us biannually. So they're due in this April. And that is not just a laboratory certification, it's an individual. So they're going to come in, they look at everything we've done for the past 2 years. They check all of our documentation, make sure our quality controls were correct, make sure everything we made was done correctly. And then they do an individual certification. And that is actually all of my analysts and myself. We have to run all the tests and then we're questioned about what's the pH of the media, how long do you incubate that sample, what's the nanometer of your light, anything you can think of, they're going to question us, make sure we know what we're doing. So then our chemistry is the Environmental Protection Agency, and that is through a program called NELAC, which is the National Environmental Laboratory Accreditation Institute. They also come out biannually. They're due to come out in September. And that is just a laboratory certification. And again, that one is pretty grueling. Before they come out, I have to send in 5 different stacks of paperwork, about 40 different pages where all of everything is written in our quality assurance plans and our standard operating procedures. So they do about a month before, they go through all of our SOPs, and then they come in, they check all of our paperwork too. And then even though it's not an individual certification, they actually take one of my analysts and watch them run our testing and question them on it too. So that is just a quick, brief overview of our laboratory. You're going to get a tour later. So if you have any questions, though, be happy to answer them.
When you said less than that 95% or less than 100, do you mean 100 colonies?
Yeah. So we actually
Microphone.
I'm so sorry.
our samplers take 100 mils of sample, but we only test 1 mil of that sample. So then whatever we get as like how many colonies we count, we would times it by 100. So because we're not running the whole 100, if there's no colonies, we have to call it less than 100.
Okay,
So we want them to be under 400. That's our goal.
perfect. Thank you.
You're welcome.
Thank you very much. If anyone has any more questions when we go to the lab,
Yeah.
we could ask those there. But thanks again. And I just want to say, you know, it's nice. You'll see that these are a close knit group of people who actually really care about what they're doing. And, you know, sometimes we think about, you know, departments and money going to them. It's nice to go there and see the integral part of our county that they are and the significance of what they do. So this will be really good. Thank you very much. Okay, next, Sunny Hill Nursing Home Report with Maggie McDowell.
Good morning, everybody. My report was relatively brief this month, but there were a couple of things on there, and certainly I'm not going to give you a blow-by-blow account. We have the information in front of you. If you have any questions relative to any of the information, I'm here to answer them. Otherwise, I just want to kind of expedite so that we can get on our tour. So does anybody have any questions at all for me? Okay, well, thank you.
All right, well, thank you. Okay, I appreciate that. This is because we want to have plenty of time for the tour. And you can pull some of the people aside while the tour is happening and kind of go to the back and ask questions if it doesn't pertain to that department. Okay, next, monthly substance use initiatives update with Kathleen Burke, Dr. Kathleen Burke.
Thank you and good morning. You have my report in front of you and all the details and the nice graphs, but I wanted to pull out, every year at this time I do an analysis of the year before, a demographic analysis. And so I wanted to call attention to a few of those things. First of all, we had the 33% decline in our overdose deaths total. Very proud of that. And as far as the demographics, our distribution of age has remained consistent across the years. So we have not seen a variation of an aging population, which some have in some of the other counties. So we've been pretty consistent. We did see a 7% increase in the percentage of women who in overdose deaths compared to men between 23 and 24. It's not a good trend. It didn't raise the number of deaths, but it certainly shifted the ratio. And then we did see a small increase in Hispanic deaths and a small decline in African-American deaths between 23 and 24, which is actually kind of where other counties are. In our particular one, they saw a larger increase in African-American deaths. We did not. We saw the decline. And part of that is because we identify hotspots and we identify, well, we're in 624 locations over the year. So we try and hit every piece of the community with Narcan. The locations, here's where there's been some change. So Romeoville saw an increase in overdose deaths compared to 2023, a big jump. We consider that a big jump. Bolingbrook, Lockport, Crest Hill, they have consistently been in the top 3 over the years. That they have larger populations, which is consistent and makes sense, but they've not changed much. What is disturbing is despite that 33% decrease in overdose deaths, some towns saw some deaths. Naperville, Tinley Park, and Orland Park saw an uptick in 24 that we had not seen before. So when that starts to spread into some of the smaller communities, you have one here and one there, and it shows you in our on the chart exactly where some of those communities are. So if you're interested, you can go and you can look for your community. It gives you a percentage of like where the location is, and it'll give you more details. And I'm happy to answer any more detailed questions about that. And then this month is designated as Substance Use Disorder Treatment Month. January was disorder treatment month. And the purpose was to draw attention to the fact that there are treatment alternatives for people and that there are support systems. So it's a way of communicating, again, the resources that we have. Any questions?
Do have to ask a question because I still in my brain, the reporting still comes from only hospitals and coroner's offices. So am I wrong in my brain?
The opioid overdose comes from the coroner. The coroner is the final resting slate for all deaths. So those numbers are totally appropriate and accurate. And so that's where we wait and get our numbers.
But for like the location, how do we determine that someone died in Plainfield when there's not a hospital per se in Plainfield? Or how do they determine that?
Yeah, so you're asking that the coroner has to give more specific. This comes up all the time.
To me.
And it's the location of the individual where they live, I believe.
Or where they're picked up. Like,
Well-
so if it's a paramedic,
The paramedics and I don't know that that's where they identify them as the death. And the reason is because they take them to the hospital and then if the person is dead, they go to the morgue, they're gonna find out their address, their real address. So I think that's where that's coming from, not necessarily the location of where they
Thank you.
overdose.
Every time I ask it, it'll get clearer in there. So thank you.
oh, let's hope with our friends to the north and south of us pledging support to fight the fentanyl crisis, that these numbers are gonna be way down next year. We had time for one more question before we go to our tour. Julie?
Thank you. I just wanted to note, with the previous question and conversation, so on the death certificate, they'll have a place typically where the person, was deceased, so they may also refer to that as well. I know they'll put in the name of the hospital if it was a hospital. So I believe that's one avenue that they're able to track that as well. Thank you.
Okay, with
Thank
that
you very
being
much.
said, we're gonna start our tour, so we're gonna turn it over to Elizabeth to direct us.
I can make one more.
Oh, I'm sorry, one more quick announcement, unscheduled.
Hi, for the record, Tim Hendricks, County Board Liaison. We're going to go on the tour, then we'll need to return to this room to finish the meeting out and do our adjournment in this room.
Oh,
So for this particular moment, I'm going to go ahead and pause our WebEx. If anybody's listening online, I'm going to be pausing it here. We'll be taking the tour and then coming back to this room. Thank you.
so we'll start in this building. If you want to leave items here for this building, but I'm assuming you want to grab your coat when we walk across the parking lot. We can stop back here and grab your coat. But we'll lock the doors. So thank you for having.
Tim, I never got this good face to with you. I'm sure from you. Morning.
Oh, sorry, man.
Oh, no, you're not.
We're waiting.
President, clear the door lock.
All right, go ahead.
Okay, we're gonna reconvene the meeting. That was a great tour. Hope everybody enjoyed it. We have any public comment? No public comment? Anyone online? You just have to say that. Committee member, comments? Edie, good.
I'm gonna, if you don't mind, Chair Butler. I would love to say thank you so much. This is good. I think it has raised a lot of questions and answered a lot of questions as well. So thank you.
Okay, no need for executive session. Can I get a motion to adjourn?
Motion to decline.
All in favor?
Aye.
Okay. Meeting is.
Thank you all
Next
so much.
meeting- Next meeting is scheduled for March 6th. In the
Yeah.
usual